Hello, everybody. This is Dr. Anthony Chang from AIMed, and we are doing another AIMed talk. And I'm so excited to have Julie here with us from IBM Watson Health, and been just dying to ask you what IBM Health has done in terms of just making a pivot for the pandemic, given that it's such a large company. So how has IBM Watson Health done through the pandemic so far? Julie?
Yeah, it's a great question. I mean, it's, something that we're all concerned about as citizens and as employees and as participants in a company that can have an impact on this global pandemic. So in addition to the highly publicized things that IBM has done as a company around the contribution to the consortium, which is building compute power for research, and the opening up of our patents and the application on the Weather Channel, which is bringing in data from the WHO and the CDC to the hundreds of millions of people that go to the Weather Channel every day. Specifically in Watson Health, there are really four areas that we've tried to contribute to helping out. One of the areas is there is an AI application called Watson Assistant, which is essentially a chatbot. And they're using that to bring fast and accurate information on COVID that can be used by citizens of a country, from our government group, that can be used by enrollees in a payer organization, that can be used by employees of a provider site. It's basically a very nice tool that could be used throughout the healthcare enterprise to bring better information on COVID. We also have a drug data bank called Micromedics, and in conjunction with Dynamed, they've developed a complementary online catalog that is giving evidence-based drug and disease education information to providers at point of care. So that is a complementary asset that can be used to really help the providers with COVID. In addition, our IBM clinical development is being offered free of charge to qualified sponsor organizations that are working on COVID clinical trials. So participating on the research side to try to bring science to bear to help with the global pandemic. And then finally, specifically in imaging, we're ensuring that our assets like image sharing and remote reading are up to snuff and being used by folks who are needing those environments ever more in this environment where people are trying to stay at home as much as possible.
Well, that's an amazing portfolio of things going on at IBM Health. So we're so excited that IBM Watson Health is going to be a big part of our AIMed Cardiology meeting coming up on May 19th. Other than the pandemic, what might you and IBM Watson Health be talking about?
Well, I'm really hoping to kind of share our perspective on how we're thinking about AI and how we see the market for AI evolving, because we sit in kind of an interesting situation. IBM wasn't a healthcare information company or an imaging company in healthcare that decided to get into AI. It's an AI technology company that decided to utilize its Watson technology in healthcare. And so there's a lot of experience and robust science and technology of AI in general across many different industries around the world. And that provides a really interesting perspective on the overall feasibility of AI and the general technology of AI and how that's evolving. But IBM also approached this from the acquisition of Merge, which brings 30 plus years of working daily with cardiology clinicians trying to make their digital experience better. And so there's a practical element to that experience that we're really trying to bring in to say, yeah, technology could be great, but if I can't use it in my daily world and it's not solving a real problem, then it's not going to help me. And the third perspective that we have is we've been very much along the lines of prioritizing collaboration, both with those providers who are working in research and also other vendors, understanding that we're not going to solve this problem by ourselves and we have to work with others. And so because we've kind of had that vantage point, I feel like we've got a really interesting way to look at both the market and the progression of the market. And I'm hoping that I can bring those ideas to light in my talk.
Well, I know there's, from talking to my fellow cardiologists, there's a lot of excitement and enthusiasm for AI tools, including Watson for cardiology, because we're in some ways have even potentially more benefit from using the tools because we have such a wide array of things we have to do as a cardiologist. So what would be some important takeaways that you're going to leave with our attendees on the AIMed Cardiology program?
Well, I hope it really gets people thinking. I do think that cardiology is in a very interesting position for AI because there is such an incredible amount of data that you have on patients, that you need on patients. And you are looking at patients from so many different aspects other than imaging, but contribute to the ongoing patient journey that they have with you. And that journey can be a very long journey. You hope it's a long journey versus a more episodic journey. And therefore, I think that I hope that the talk really brings people some good questions to ask themselves about where they fit into this journey and how they want to contribute to it. Do they want to be somebody who's going to be a voice of practicality? Do they want to be somebody who's going to be a voice of feasibility? We need everybody to participate in this journey in order to kind of get through what will be a kind of a bumpy ride, early on. I think a lot of clinicians like you have probably experienced some of the learning lessons of new technology, and those will continue. And I really hope this provides people with an opportunity to raise questions and think about their own journey through AI.
Yeah. No, I think it's an amazing new resource that we're very lucky to have. It's a once a generation, I think, opportunity. So I think that the cardiologists will really band together and take advantage of the amazing tools that we have. So thank you so much, Julie, for the wonderful talk, and look forward to seeing you very soon. Thank you, Julie.
Thank you. Have a good evening.